question of how the protein in our diet affects bone health is really a controversial one. You might have heard that you need extra protein or that too much protein poses risk. In this section of my interview with bone expert Jeri Nieves, Associate Professor at Columbia University and Helen Hayes Hospital, I'll ask her about this. The thing with the protein where some people are concerned that they need a lot of protein to build more bone and other people are saying, oh, too much protein is bad for your bones.
Yeah, the data there is interesting, and it seems like at either end of the age spectrum, you want to maybe have a little bit more protein for people during their growth stages, or for elderly, they want to at least consume the right amount of protein. If you look at the American diet, we tend to eat too much protein. And when you look at these excessive amounts of protein, there were some concerns that we were maybe changing the pH of our body, and that the meats and certain foods maybe were making us also excrete more calcium in our urine. But if you have enough calcium, you don't need to worry about that as much. And if you eat the right amount of protein and not the excessive amounts that people tend to consume, there should be no impact on your bone health.
Right. So we get these messages that make it sound like it's very complex, or that eating for bones would be like another concern beyond eating for lower cancer risk and heart disease protection. But it sounds like the kinds of messages that you're sharing based on bone health and that I'm sharing based on cancer risk really...
They're very similar.
That's great. Well, thanks for taking this time, Jeri. I really appreciate it.
It's my pleasure. Thank you.